If you follow me on social media and listen to the podcast, you know that I despise cervical collars. I think that they do more harm than good. I would submit that we know this by now, but we are still mandated to apply them to our patients who are at risk for spinal injury because our policymakers and policy influencers like the American College of Surgeons, ACEP, NAEMSP, etc., still cling to them. And I think that while there is a genuine concern for worsening a known or hidden spinal injury, I'd be willing to bet the farm that the real root cause nobody will let go of these collars is because of fear of being sued by a patient who experiences a worsening spinal injury. Secondary spinal injury is a real thing. In fact, most patients with a serious spinal cord injury will experience a secondary injury, and indeed, those secondary injuries are associated with worse outcomes. However, it's coming to light that it's not necessarily the movement of the spinal column that causes the injury. Rather, it's the force of the blow that damaged the spine. And as far as secondary injury, I'm not saying it's never happened or that it can't happen, but secondary injuries most commonly result from inflammation, infection, and excitotoxicity, all of which are things that a cervical collar isn't going to do a damn thing about. So let's take a look at ACEP's policy recommendation for pre-hospital usage of cervical collars. And thank God we no longer have to put them on absolutely everyone, but I submit that we still put them on way too many people, and that ACEP, American College of Surgeons, NAEMSP, whatever alphabet soup organization need to go further and employ some evidence-based medicine. This guideline was published in 2018, so I think it's probably time to revisit it. It's been 6 years, but let's take a look at the references they cited. Anyone who has gone to grad school and has written a paper will tell you that your professors say that when it comes to citing other scholarly articles, 10 years for social sciences and 2 to 3 years for science references because science is so dynamic. Here we have, remember this paper is from 2018, so here's a reference from 2014, 4 years old, 2012, 6 years old, 2010, 8 years old, 2009, 9 years old, 7 years old, and 4 years old. Naughty, naughty. If you were writing a paper for school, you'd get a big -5 on the score for relevance of your citations. And look at this. They cited themselves, and it's not even a study. It's another ACEP position statement. Again, -5. But ACEP can do this while Joe Shit, the grad student, would get reamed out for doing the same thing. I think that ACEP needs to get on PubMed and start looking at the scores of published articles that are out there that convey that C-collars don't do a whole hell of a lot of good. In fact, they do more harm than they do good. I did a whole podcast episode on this a couple of years ago. I recommend you go check it out. Here's what we know about C-collars, and here's what some of the academics who are going, are publishing. ACEP, take note. You can check me on dates. I'm sure some are more than 2 to 3 years old, but if ACEP can do it, then so can I. But even if some of these are a little older, then shame on everyone because this knowledge has been known for quite a while. It's been out there, but for some reason it hasn't made it to the references list for policy statements like the one we're talking about. There is an emerging body of evidence that cervical collars do more harm than good and that we should not routinely use them or simply stop using them. Great paper, full text is available and free. Read it. Patients who move themselves are no more prone to further injury than traditional means. This is what I've been saying all along. You move the patient more putting on the damn collar. Any drunk or elderly person ends up moving their spinal column more, trying to force themselves out of the collar. There is a known correlation between collar usage and adverse events like ulcers, infection, exacerbated spinal injury, and higher morbidity. We know that cervical collar usage increases intracranial pressure. But that might not be a good thing for the neurotrauma patient. And cervical collars cause pain. Fifth vital sign, and they cause tissue breakdown, which is no small thing. One study of 342 patients, and yeah, not a massive sample, but this was in one level 1 trauma center, and this was in 1 month of a study period. If you moved this to 12 months, that would be a little bit over 4,000 patients. And if you multiplied that by 2 or 3 trauma centers, it would be 8 or 12,000 patients. In that study, 60+% of those patients had some degree of pressure injury, whether it was indentation in the skin or it was something more significant like a pressure ulcer. The majority of patients complained of pain, and 38.5% complained of severe pain. And the authors concluded that pain due to the application of what they call the extrication collar may lead to undesirable movement in order to relieve the pressure from the collar, and that it is necessary to revise the current practice of C-spine immobilization. Enough said.